Good morning, students. This is Professor Eknath Damu Ahire. I am assistant professor currently working at Divine College of Pharmacy, Satana. Today, we are going to see about pharmaceutical legislation and various committees, which committees are important for the setup of ancient or the base of the pharmaceutical legislation in India. So, as we already discussed in previous session, the different type of or the basics of the different committees or the different eras or the different events of the pharmaceutical legislation. In this session, we will discuss about in detail pharmaceutical committees or the pharmaceutical legislative committees which are important to set the pharmaceutical legislation in India. So let's start. First of all, we will see the introductory part. At the end of the 19th century and early of the 20th century, use of allopathy system increases. The drugs of natural origin, for example, vegetable, mineral, oil, and animals, were also increases. At that time, profit became main motive than service. Most of overdoses are there, like quinine, using croton oil in eye instead of atropine oil, which is very dangerous. Inadequate dispensing and selling, selling behavior, excellent dumping of drugs, which is very bad for the health. The drugs are badly adulterated, which is again very destructive to human health. Instead of quinine, chalk tablet is used, so there is a no effect of quinine. Drugs like serotonin were badly adulterated. Again, this is a very bad thing. Potent drugs like antimony, arsenic, and digital is marketed without any standards. Again, this is a very dangerous to human health. Leading article published by Indian Medical Gazette in 1927 and 1929, which said about this condition. India becomes a land of quacks and quack doctors, quack medicine mongers, quack dentists, quacks of medicines, quacks of opticians, quacks of faith healers. There was practically no legislation to control on drugs as well as on the pharmacy profession. So here is the origin and nature of the pharmaceutical legislation of India. The earlier the allopathic system of medicine was brought by Britishers to our country and allopathic medicines were mainly imported. So we have to depend upon other countries for the allopathic medicines because in India there was no any pharmaceutical industry is there uh, which will be manufacture the allopathic medicines. To have some control on the import, the British rulers introduced some acts like the Indian Merchandise Marks Act 1889, the Sea Customs Act 1898, Indian Tariff Act 1894, the Opium Act 1878, the Poison Act 1919. They were not comprehensive enough to control the chaotic and deplorable conditions in the drugs trade and industry. So, first of all, Government of India constituted one drug inquiry committee, which is the main milestone or the main basic committee, and from this committee the Indian legislation history is started. On representation from the Indian people, the Viceroy appointed a committee on 11th of August 1930 under the chairmanship of Colonel R.N. Chopra. So this committee, also called its Viceroy Committee or R.N. Chopra Committee or Drug Inquiry Committee. The report was published in 1931. The committee aspects were: first aspect, to inquire into the extent to which drugs and chemicals of impure quality or defective strength, particularly those recognized by the British Pharmacopoeia, are imported in the public interest of controlling such importation, manufacturing, and sale, and to make recommendations. Recommend, Recommendation to overcome the above. The inquire into the necessities of legislation to restrict the profession of pharmacy to duly qualified persons and to make recommendations. So, recommendation number one is a central law to control drug and pharmacy profession. Second one, setting up the test laboratories in all states to control the quality of production of drugs and pharmaceuticals, and a control laboratory to control the quality of imported drugs and also to act as expert referee in case of disputed samples sent by local governments. Next one, appointment of an advisory board to advise the government in making rules to carry out the object of the act. Uh, Fourth recommendation was setting of courses for training in pharmacy, minimum qualification for registration as a pharmacist. Next recommendation, registration of every patent and proprietary medicines of undisclosed formula manufactured in India or imported from outside of country. The crude single drugs as well as compounded medicines used in indigenous system of treatment should be brought under control. The drug industry in India should be developed. The gradual reduction of manufacturing in medical stores, depots, compilation of an Indian pharmacopoeia. The Syncona department should cultivate Syncona only. And final some outcomes of this committee reports, like enactment of import of drugs bill 1937, drug and cosmetic act 1940 and rules 1945, pharmacy act 1948, drug and magic remedies or the objectionable advertisement act 1954 and rules 1955, medicinal and toilet preparation act or excise duties act 1955 and rules 1956, and publication of first edition of Indian Pharmacopoeia in 1955 based on the British Pharmacopoeia 1948. First edition was published in 1955, second in 1966, third is 1988, fourth one is 1996, fifth one is 2007, sixth one is 2014, and recent seventh edition is in 2018. So some states acts also there, but again in previous session most of people asking me that sir, uh, some of state acts also there, so it is related to state act only. So I clear over here for all of you, there were no state acts nowadays. This was ancient India before or during the period of the Britishers government. Okay, now we have the centralized acts which controls overall India. Okay, so we were studying about the ancient India or the ancient acts. Okay, so in some of states there are separate acts over there, like in Bengal Municipal Act was there, Bengal Food Adulteration Act was there, Bengal Excise Act was there. In Madras Prevention of Adulteration Act was there. In Uttar Pradesh, United Province Municipal Act was there. In Punjab, Pure Food Act was there. Municipal Act was there. In Bihar and Odisha Municipal Act was there. Prevention of Adulteration Act was there, and Excise Act was there. So these acts only related to the particular state only. Okay, and uh, after some time, or the after the independence India, these acts were prevented, and all India unique acts were implemented there. And nowadays we were following the unique or the overall uh, centralized acts were there or are there. Then some of different committees over there, and these different committees are for the implementation of different type of acts which were taken by the drug inquiry committee. um, these committees are BHORE committee, BHATIA committee, MUDALIAR committee, and HATHI committee. So we will see one by one. The BHORE committee was constituted in October 1946 for the health survey and development purpose by the government of India, and under the chairmanship of Sir Joseph Bore. Committee recommendations: establishment of All India Pharmaceutical Council and Province Pharmaceutical Council, strengthening the profession standards of pharmacists, maintaining disciplinary control, starting of revised courses of study, setting up of Central Drug Laboratory, rigid enforcement of the Drug and Cosmetic Act 1940. So these are the recommendations by the BHORE committee, and they were implemented. And second committee is Bhatia committee, which was constituted or appointed in 1953 by government of India. Uh, and this committee is appointed for the implementation of pharmaceutical inquiry committee's recommendations, and it was under the under the chairmanship of Major General S.L. Bhatia, made a comprehensive inquiry into the working of pharmaceutical industry in June 1954. 212 recommendations have been implemented by this committee. Uh, Next committee is Mudaliar Committee. In 1959, Healthy, Healthy Survey and Planning Committee was appointed under the chairmanship of Uh, Dr. A. Lakshman Swamy Mudaliar recommended the inclusion of indigenous system of medicine under the purview of Drugs Act. Then last one and important committee was Hathi Committee. The important milestone in the pharmaceutical legislation history is Hathi Committee, and it was under the chairmanship of the Jaisuklal Hathi. This committee covered all the aspects of licensing, price control, imports, role of foreign sector, and quality control. So this was the some important committees. For more information, you can access this following textbooks, references, and happy learning. So enough for the day. Thank you so much for being here once again.